Thanks for staying with us. Let's turn to health matters now. The Minister of State for Health and Social Welfare, Tunji Alausa, is working on getting the Federal Executive Council to fund medical research in Nigeria. The minister was speaking at the inauguration of the Center for Human Virology and Genomics, Secretariat at the Nigerian Institute of Medical Research. Senior correspondent Sarah Ayeko reports.
For the third time, the Minister of State for Health, Tunji Alausa, is visiting the Nigerian Institute of Medical Research, Yaba, this time to inaugurate the Center for Human Virology and Genomics and Secretariat of the National Health Research Committee. It was received by the outgoing Director General, Professor Babatunde Salako, other directors and researchers at the Institute. The Minister of State for Health and the Institute took delivery of a new set of hepatitis B virus test kits that can quantify the viral load of HPV in plasma samples from patients. With the hepatitis B virus prevalence of over 13%, millions of Nigerians can benefit from this cheaper alternative.
In the pipeline, we are currently designing 3 innovations, including an assay for the development of hepatitis C quantitative kit. And as part of our international contribution towards achieving the Sustainable Development Goal, which aspires to ensure health and well-being with a bold commitment to eradicate AIDS by 2030, our researchers are currently developing a microbicide vaginal gel for HIV preparation in women. The project has gone through the in vitro preliminary studies to assess the safety of the gel on vaginal microbiota, the cells, and its efficacy on HIV-1BL virus strain. The results were promising, and the outcome has been published.
The Institute is also seeking the Minister's intervention to get a quick approval from NAFDAC.
The government has to fund research. It's a collaboration of government and international funders. We're working on getting a memo to FEC on how Nigerian government would fund research. I won't be able to tell you the detail of that, but I just want you to know this is extremely important to this government, and we're proactively working on that.
At the height of some of these contributions to medical research in Nigeria, the Director General of NIMA is expected to bow out of service in July this year. Sarah Ayeko, TVC News, Lagos.
Staying on health matters, nutrition and dietary management have been identified as the key component of overall well-being of a patient. This was the crux of discussion at this year's Clinical Nutritional Conference held at the Lagos University Teaching Hospital, Idi-Araba, with the theme Advancing Clinical Nutritional Care, Regional Guidelines and Standards for Parental and Enteral Nutrition. Experts at the meeting believe that right dieting is fundamental for the health and safety of individuals, as well as a basis for sustainable development and economic growth of any nation.
All the key disciplines that are involved in taking care of the patient as it pertains to nutrition got together and started talking about guidelines and how they need to make sure that when patients get admitted to the hospital, they are screened, meaning their nutritional status are screened. And this is typically done by nurses and in some cases by physicians.
Whether you're sick or you're healthy, nutrition is very important to all of us. And it's so more important for somebody who's sick, because whatever medications are going to take, you need to be healthy. So nutrition is so important. Men, women, young, old, all sorts of illnesses, cancer, whatever, nutrition is also very important. So launching this and also launching a youth committee in charge of nutrition is also very significant.
We hope that going forward, clinical nutrition, parenteral nutrition, enteral nutrition will be accessible to all, and then we have life. Because sincerely, no nutrition, no life. Nutrition is health, and nutrition is wealth. You can only make wealth when you're healthy. So if there's no nutrition, there's no wealth, and there's no health, and there's no life. So no nutrition, no life.
Let's turn to the environment. As the world marks World Environment